There you go. Thank you so much. Apologies.
Got it. Yes, thank you, Annette. Yeah, so I'm gonna share my screen. Let's see. Oop. Okay. So yeah, so I'm going to talk about the Josephine County Suicide Prevention Coalition. I am the Suicide Prevention Coordinator with options for Southern Oregon. We reside in both Josephine and Jackson County, but my county is Josephine. So the Josephine County Suicide Prevention Task Force was created in 2016. I've been in this position for just over a year. So I was handed a task force that hadn't been meeting since before COVID. And so we pretty much were almost starting from scratch just a little over a year ago. And one of the things that we decided to do was to change it from a task force into a coalition. And we wanted to do that because we wanted to increase participation from the community and also community members with lived experience. And you'll see that our members, we have a really amazing presence of professionals on our coalition. And we have local mental health organizations, the crisis response, we have law enforcement, juvenile justice. We have both admins and behavioral health support from the local school districts, DHS, the VA, both from our main hospital and our clinic. The different advocacy and resource groups. And we only have a few community members. So we really felt like we wanted to make that transition from a task force to a coalition because it made it seem like it was more inclusive and open to the community. So for the last year, our areas that we've been wanting to focus on were, number one, better communication between law enforcement agencies and the emergency department with the schools. The second one is creating more of an official post-prevention response team outside of the small few people such as myself and maybe one or two other people that respond to suicide deaths, and to make that more larger so that we could respond more effectively and inclusively, depending on different cultural identities, and to make it more of an authentic response. We also, before I joined, there's a lot of conversation about creating materials for postvention, and so that's another area of focus. And then the third is our county is very rural, and most of our suicide deaths, like other parts in Oregon, are with firearms. And so we wanted to focus on some lethal means reduction, which hasn't been an area of focus in our county in as much in the past. So the first thing that I wanted to go into and probably spend the most time on is addressing the communication gaps between law enforcement agencies and the schools. And the idea came from one of our admins from Three Rivers School District, wanting to know if we would be able to look into the Handle with Care program. And so after doing some research, and bringing that back to the coalition, we decided that we wanted to go through with it. So in partnership with the Grants Pass Police Department, Josephine County Sheriff's Office, the Oregon State Police, both school districts, and with the support of the Suicide Prevention Coalition, we've been able to make this happen. And our launch date is in April, so next month. And so a little bit about Handle with Care. We would be the second county in Oregon to implement a program like this. Wasco County implemented it about 5 years ago. And it's basically a notification system between law enforcement and the school districts that allows the law enforcement to send a notice to the school when a child has been identified at the scene of a traumatic event. And that can be anything from a house fire to an arrest, to a homicide, a suicide. It doesn't have to mean that a violent happening occurred or a criminal activity occurred, just that the child was exposed to trauma. And so once the child's school has been identified, the law enforcement officer sends a notice through a specific email that only states the student's name, their date of birth, and the phrase "handle with care." So that's the only information that is transferred. And so just to go over what Handle with Care is and what it is not. So it is a notification system between law enforcement and school districts. It is to identify students that have been exposed to potentially traumatic events. It is something to ensure that students receive appropriate trauma-sensitive and trauma-informed interventions. It supports staff in managing difficult student behaviors that could be stemming from trauma. And it gives the staff the opportunity to get ahead of these potential challenges in the classroom. And so what Handle with Care is not, is it is not a rumor mill. The notifications only go to the designated school personnel. It is not an opportunity to ask questions. So staff who receive the notice do not ask the students anything. They respect their privacy. It is not a guarantee that a mandatory report will be necessary. So it doesn't mean that the child is unsafe at home. So we want to have people not assume that a Handle with Care notice means something that it's not. And then also it's not an invitation to rescue a student. The staff focuses on healthy supports, including setting boundaries, empowering the students, and recognizing when students need a break. And so this started in West Virginia in 2013, largely because of ACEs. And so ACEs, there's a study that stated that children that experience, or adults that experience 4 or more ACEs, so adverse childhood experiences, were more likely to experience different things in life. And one of the things is that with 4 or more ACEs, your number of suicide attempts goes up by 14, or 14 times more likely to make a suicide attempt. Also 4.5 times more likely to develop depression, 11 times the level of intravenous drug abuse. So can be a direct correlation. So that's why we chose as a coalition to move forward with this. So the implementation process, we got mentorship from the Sheriff's Department and Wasco County School District to kind of go over what their barriers were. And they spent almost a year getting their MOU signed by all of the stakeholders. And so we were prepared for that. but it took us a month to get all of the MOUs signed. So we were really happy about that, and which is making it possible for us to launch this next month. So I don't think I need to go through all this, but if anyone has questions, I can answer them at the end of my presentation. So the next area of focus was the postvention materials. And so we, after talking with chaplains and with the crisis response and different folks with the lived experience, we felt that doing various different types of materials was necessary. So at the immediate scene or response, that law enforcement will be giving a magnet to the law enforcement, or the chaplains will be putting a magnet on the refrigerator with resource numbers, or at least a website where people can go, so that way in the chaos of the aftermath, when people get papers, they just go and they don't know where they are, they don't want to read them, and so we figured that a magnet would be good for that. And then also creating a resource card that gets mailed inside an envelope. And this that I have on the bottom is a proof of one side of the resource card. And then also working on developing a guide similar to the TIP guides that they give out, the trauma incident program. So that is what we're currently working on and meeting and trying to develop for that. And then the last thing is working to connect with the firearm community. We have been wanting and identifying people within the community and within our coalition to do outreach to the different gun ranges and firearm distributors. And so that is going to happen because and Donna Marie is in the meeting. But so we're going to have Donna Marie come down and do some in-person firearm QPR trainings. And we're going to get ready for that. So we've had a lot of movement in the last year, and there's a lot of excitement for us to move forward and to bring it out to the larger community. And yeah, so we meet every fourth Monday through Zoom, and I think we're probably going to stay on Zoom. We were thinking about doing a hybrid meeting, and at this point, because we meet monthly and not quarterly, the Zoom option seems to be the best. So,
Angela, that it's a lot that you've achieved in a short amount of time. One,
yeah.
Really impressive, and two, I'm curious about the program, and now I've forgotten the name, but the one you're doing about the communication between law enforcement and schools. Was there a cost to doing that?
There is not. It's very simple, because the hardest part is just getting everyone on board. And so when you're working with 3 different law enforcement agencies, to get the top person to sign off on it, that seemed to be the hardest part. I mean, we had our first meeting for the Handle with Care, and I was blown away by the presence. I didn't have to pull teeth at all. So, and we identified, our champions within each of the school districts and the law enforcement. And it took us I think 6 months is the amount of time from when it was first brought up in the coalition to now.
Great, thank you. Any other questions just before we move on? Gally?
Hey, Angela, great work. It's really cool to hear about all the stuff that you all are doing. It's really cool. So nice job. I have a question also about the handle with care process. So when law enforcement notifies a school about, in this case, a suicide, does that take the place of the school being notified? Like, is that how the school learns of a death from suicide in the community, or does that come, is there another form of communication that comes, or is that how they learn?
There's another form, because with the handle with care, there's no mention of what happened. So that wouldn't actually be sufficient, because it would just give the child's name, date of birth, and the words handle with care. And so the communication about suicide deaths to the schools is still with the postvention lead. And yeah.
That makes sense. Okay, thank you so much.
Yeah.
Well, thank you so much. It's great to hear. And I'm really struck by how you are doing things that will impact young people, which we, of course, are all about here at the Alliance. And with some of the other efforts, the firearms, et cetera, that you really are doing lifespan work as well. So nice way of threading that needle and being there for lots of different people.
Yeah, thank you.
At this point, I think what I will do is switch gears and invite Rachel and Shannon to come forward and to share a little bit about sort of the incredible training work that's been happening around suicide prevention through DHS and some of the collaborative work happening there.
Okay, thank you. I have a PowerPoint, but it's telling me the host disabled my slide, which is fine.
Oh,
I can do.
Sorry, I thought Shannon was going to do it. I can. I will give you just a second. Right.
And I'm going to talk fast and try to get through this as quickly as I can. I have a lot of information. I want to make sure Shannon
should be good now.
Okay, let's see what I've got here. All right, are you seeing that okay?
Yeah.
Everything's funky. Okay. So thank you so much. Yeah, I'm really happy to be here. I'm Rachel Howard, she, her pronouns. I'm the Suicide Prevention and Behavioral Health Promotion Coordinator at Child Welfare. And as you see here, I'm seated on the Child Fatality Prevention and Review Program, which I'll talk about here in a second. Just a really brief background on me. I'm old. I began my career as a child welfare caseworker back in 1999. I worked for Child Welfare in all the different roles in Oregon and Washington for about 10 years. And then I left Child Welfare and moved into clinical world. So I was a clinician and then a program manager in mental health for many, many years. And I came back to Child Welfare in my current role about 1.5 years ago and was happy to see a lot of changes in child welfare since I started 24 years ago. And a driving force of that change is this, and which you may hear mention of when you talk to people in child welfare. And this is our vision for transformation. So this is really the guiding framework right now within child welfare that we're using to inform our programs, our planning, our future strategies. And it has 3 guiding principles. One is that we are supporting families and we're promoting prevention. We're really looking at hoping to get an understanding of what families need to be safe and stable. So we've really shifted from being kind of that reactive agency that I think traditionally child welfare has been. And we're really focusing on prevention and being proactive and providing upstream supports to families. The second principle here, enhancing our staff and infrastructure, really is just geared towards making sure that our staff have the tools and the knowledge and the skills that they need in order to best support the families and being safe and stable. And then the third guiding principle is to enhance the structure of our system, making sure that we're using data-driven measures and that we are continuously looking at quality improvement to make sure that what we're doing is relevant and effective. So the development of the Child Fatality Prevention and Review Program really came out of child welfare's critical incident review teams. We call them CIRTs, and those are the reviews that happen when a child has died, either while currently being involved with child welfare or having been involved with child welfare within 12 months. And the death is suspected to be the result of abuse or neglect. So it is the Child Fatality Review Team. CIRTs were statutorily mandated in 2017, and prior to 2017, they occurred, but they were kind of haphazard. They happened within the branches. They had HR involved, and a lot of times they were just really challenging. They were kind of conducted in a way that was perceived as punitive, and I think were punitive, and they placed a lot of responsibility on the shoulders of the direct staff working with families. And over time, and as part of kind of learning processes and our effort to transform, it really became clear that these CIRTs were an opportunity for us to look at broader systemic issues, that if we had staff who weren't able to do their jobs, it was not their fault, it was system problems, and that the system needed to be responsible for helping and support the work. So it was just kind of a blame game before that, and that wasn't very useful. So the CIRT statutes came in, and then in 2019, there were additional statutes that came in that provided structure and guidance to how we conduct the reviews and what cases qualify for reviews. And currently, the goal of our CIRT process is to really identify opportunities for improvement, if any, come out of reviewing those cases. Our goal is to prevent future fatalities, and we do that by developing and implementing systemic improvement changes. So as the CIRT numbers increased due to those statutory changes, we were able to kind of identify some main areas for focus for prevention efforts, and it became clear that there was a need for an actual team for the ongoing management and maintenance of those efforts. So the Child Fatality Prevention and Review Program was developed in 2020 as a way of really centralizing and formalizing the management of child welfare's prevention efforts. It's not the only team that does prevention efforts, but we kind of oversee and drive a lot of them. So currently, the Child Fatality Prevention Review Program is made up of multiple coordinators who, again, are tasked with coordinating those CIRTs. They manage the recommendations that come from the CIRTs. We engage in safe systems analyses of all the critical incidents. We work with multiple child serving systems. We collect and analyze data to inform future prevention efforts. As you can see here, the team is involved in a number of prevention initiatives that have come to light as a result of the CIRT processes. So this involves things like infant safe sleep, comprehensive addiction and recovery supports, issues related to chronic neglect, and suicide prevention. So when the CIRT began tracking cases in 2017, we didn't have that many cases because there weren't a lot of them that qualified under the statute that now would qualify. So the guidelines were pretty new, but you can see here that almost 50% of the cases that were reviewed that year were youth suicide deaths. And over time, as we began to kind of see these patterns, we saw that our staff were having some type of contact with young people within that 12 months before their suicide death, and really identified this as a missed opportunity to identify that suicide risk and be really proactive about prevention and intervention. It also became clear that our casework staff needed additional help, knowledge, and skills to support them in suicide prevention efforts. So a dedicated suicide prevention coordinator position was created in order to implement and coordinate all the changes that were needed for us to prevent future suicides for youth involved with child welfare. In 2019, ODHS Shared Services and OHA partnered with Child Welfare and obtained a Garrett Lee Smith grant to support us in training our staff. And QPR was identified as kind of a valid, easy to administer suicide prevention training program. So in 2019, there was a large initiative to train ODHS staff as QPR trainers, and we trained over 100 of them. And then 2022 happened, and we all kind of know what happened then. So we pivoted, and QPR became computer-based. And Shannon will talk a little more about the broader ODHS efforts. But as the training uptick continued within child welfare, we saw that we needed kind of a nuanced training for child welfare staff. The circumstances in which we're in people's homes and lives is very unique and challenging at times. And so in collaboration with the QPR Institute, we created a specialized facilitated child welfare QPR for child welfare staff so that we can address some of those really unique characteristics of our contact and engagement with families. And we started offering this facilitated QPR training weekly to staff from mid-2020 through 2021. So to date, approximately 900 child welfare staff have been trained in QPR. New employees are required to complete QPR training within a designated timeline. We've shifted to having them quarterly instead of weekly, but we still have them. And then again, Shannon's going to talk a little more about the broader QPR training. As part of our continuing, efforts to look at CQI, we do pre and post training surveys of all of our staff. So immediately before the training and immediately after, they take surveys. And what we found is that overwhelmingly the response is positive, that staff report that they've improved their knowledge base, they feel more comfortable talking about suicide, and they feel like they have a better understanding of some suicide prevention strategies after completing QPR. But even with that, there continues to be kind of ongoing needs. We had the opportunity to meet with a lot of staff and leadership within child welfare, and what I continually hear is, yes, QPR is great, but what do we do when someone says yes? Or what do we, how do we navigate these really complex families and these really complex youth? And we have our challenges in our mental health systems, we have our obligations and our responsibilities and everything. How do we navigate that? So we have a staff who's really motivated. They really want to assess risk. They really want to intervene appropriately and safety plan. And so we've heard these kind of collective statewide asks for more. So even though we have had a lot of success with QPR, it became really clear that we weren't done yet. And so we do more things. One of the things that I have the pleasure of doing is I attend several local suicide prevention coalitions, and I will admit I just kind of invited myself when I started. So those of you on the call who have graciously allowed me to join, I appreciate it so much. Our hope in attending these is to really bridge those gaps between child welfare and all of the local efforts. I know that child welfare in the past has kind of been this, fortress of solitude or something, and we really, really want to change that and shift that dynamic. And I think it's important to note that it's worked. And that the connection is really valid and important. I had a school employee outreach to me after a suicide prevention coalition meeting that I attended in one county and expressed concerns about how they felt their calls to our Oregon Child Abuse Hotline, the ORCA hotline, were being received. They really didn't feel like they were being validated when they were calling about concerns with youth experiencing suicidal ideation or behaviors. And so I took this feedback to the ORCA leadership, and they were amazing and super invested in fixing it. And so last fall, in collaboration with ORCA, we created a youth mental health and suicide risk assessment and screening training that now all hotline screeners receive as part of their initial training and ongoing training that helps them look at things like compounded risk, different impact factors, mental health system navigation, et cetera. So we've had a systemic change that came from just one person reaching out to me in a coalition meeting saying, this isn't working for us. In my role, I get to collaborate with community partners. I work with ODHS shared services, I work with OHA, local coalitions, all the different programs within child welfare, hospital systems, et cetera. And my hope is that we just continue growing our presence as much as possible and connections with all of those community partners. And then I also support our local workforce in their case planning. I sit in on several internal work groups and committees, and then I also am invited to consult with individual cases when we have families or youth who are struggling, and we have caseworkers who need feedback or guidance on how to do that. And kind of looking ahead, we've got some really fun things that we're doing. We are currently partnering with OHA and the Oregon Pediatric Society to develop and implement a child welfare specific youth safe training. So again, because of that really unique dynamic that we have in a family's life, we are creating a youth safe training that's going to recognize those unique ways that we may be communicating and engaged with families, and are really excited about the development of this and our implementation of it. We have several job classifications throughout child welfare that we're going to prioritize for that training. And then eventually what we'll be having is kind of a tiered training structure for all staff within child welfare to receive either QPR and or Youth Save as well. I'm working with our equity training and workforce development team to increase supports available for resource parents. We have a resource parent specific QPR that they provide regularly. And then we're also looking at enhancing that and adding additional supports to resource parents so we can help them meet the needs of the children that are in their care. We're going to continue with our QPR efforts. We've also implemented a 6-month post-training survey system, which kind of as we speak, we are sending out our first cohort. We really want to look and see about kind of that training drift and address any ongoing needs that people may have once 6 months have passed since they were trained. And then I'm also going to continue to be available to the community and internal staff to collaborate or network or consult or whatever. So if anybody's inviting me to the table, I'm happy to show up. And that's about it for child welfare. It's kind of our past, present, and future. And now I'm going to pass it over to Shannon. Thank you.
Thanks, Rachel. I've got to share. Jen, am I good to go?
You should be. Let me
Okay.
know if it doesn't. Yeah, you should be.
Let's wish me luck. Oh, we're on the Zoom thing. Here we go. Let's
We can see PowerPoint.
see. Can we see my hand? There we go. All right. Hi, everybody. My name is Shannon Biting. My pronouns are she, her, and I am the ODHS trauma-informed organization advisor. It's the weirdest title I think that we have. And basically, I manage a program called Trauma Aware for the agency. And some of you may know Don Erickson. He actually is on the board of the Alliance. He's our Chief Administrative Officer. And in 2018, Don formed a work group comprised of diverse representation of different programs and offices in ODHS and OHA to create a policy that would develop a trauma-informed care framework for us. And that was adopted in 2019. And in 2020, I had come over from 20 years at child welfare, just maybe 21. So Rachel and I started around the same time, but so I don't know, 24 is the lucky number, but had spent all of my time there and in between doing some work with self-sufficiency, and then moved over into this area to build out a program. And Don said he wanted something done with this policy, and he also wanted something done around suicide prevention. And so we've been working together since then to get this program rolling. So just want to share a little bit about the program to help provide some context. So it is the name of our program within ODHS, and we do sit in shared services. And so we work closely with OHA in some of these different areas and hope to build upon these areas as well. But we really have 4 areas of connection, and you can see even just from the visual how they overlap. So our trauma-informed care work is focused on applying, what we know about trauma and creating programs and services. And we try to utilize a human-centered parallel process approach, recognizing how our agency operates with our employees, and that is mirrored in how they will interact with Oregonians. So largely our program is focused on our workforce, and then of course the parallel process. So some of the things we do in this area includes consulting and training with our programs within ODHS and OHA to consider best approaches with Oregonians. And it also includes processes related. Oh, I'm repeating myself. Anyways, you can never emphasize that too much, but sorry. Some of the examples include tools for debriefing situations. So like involving very vicarious trauma, we have a debriefing tool that assists managers and supervisors, and can even be used by our employees with their peers. 5 different approaches to debriefing situations. So that's an example. We have trauma-informed language tools. We work with some offices around revamping their notifications, so they're using trauma-informed language. We have a trauma-informed de-escalation training and tools. And we review communications to adjust language to be less activating for folks. And so those are just some examples. And we also work in close partnership with Trauma Informed Oregon. Our trauma response services largely is when we're responding to specific incidents or concerns for teams or individuals. So it varies what we offer, from one-to-one peer support conversations to facilitated team dialogues. And we do outreach to employees in times of crisis. One of the programs that we have is CISM, which is the Critical Incident Stress Management. We offer peer debriefing sessions, and folks here, I'm sure, are aware of CISM or have heard of it. But we really utilize it after a critical incident or traumatic event. So some of those might look like an employee loss, or even violence that unfortunately has occurred in one of our lobbies. And we've had several occasions of overdoses in some of our offices, and that's very traumatic to the employees that are responding. We do have, going down a rabbit hole, but just so folks here know, we have Narcan in every ODHS office. It's available and training to our employees as well. We have an employee resource network, which was developed as a result of the fires in 2020. And we have a team of navigators that help employees when they have been directly impacted by natural disasters. And we're currently in the process of working with the Trauma Resource Institute to begin developing a team of teachers for the community resilience model to work with our workforce and our community partners. We offer workforce well-being, where we're really trying to focus on employee healing and resilience, and really driving a commitment to developing trauma stewardship, and focusing on not just self, but community care as well. And then, of course, we have our suicide prevention, intervention, and postvention work. And we've been building this program, like I mentioned, since the beginning, back in 2020. And I'll mention the QPR in a second, but we're also focusing on the postvention work as well to help with our workforce. Unfortunately, we serve between 10,000 and 14,000 employees, and unfortunately, we have lost employees to suicide. And so it's really an important topic to us. So moving on, and I'm looking at time, Annette, so I'll try to go as fast as I can without too much talking too quickly. So in 2020, we did launch a computer-based version of QPR. It's approximately 50 minutes long. It also provides a whole host of resources and information that employees can utilize both in their professional capacity as well as personally. And Rachel mentioned the survey, and we do offer that as well. So we have a pre and post survey, which Portland State University actually analyzes for us, and that is included as a part of the training experience. The training is accompanied by a trauma-informed guide we developed that explains what QPR is, what the training will cover, how to prepare for the training. So we launched it in 2020, but in April of 2021, ODHS recognized its commitment to the topic of suicide prevention by actually requiring QPR training for our workforce. And to get a training required at ODHS is like a really big act. So it was a great deal to us. It was very exciting. We did offer and still do a no questions asked opt-out for employees who might not be in this space to take the training. And while it's a very small number, we do have some concerns where this topic may show up for some folks in their jobs. And so Rachel has been very excellent about advocating with us to see what we can do to try to approach folks who opt out but may need this training. So something we'll be working on in the future. To date, we have close to 9,000 ODHS employees have been trained in QPR. We're currently working with the Department of Administrative Services, known as DAS to state folks, and the QPR Institute to bring the training to all other Oregon state agencies. So we're super excited about that. We have a small but mighty team of assist trainers, and we have lots of friends in this audience today. Kristen Fettig's one of them. She's going to be helping us with our assist program. And then, of course, we're working with Chris Bifocal and Laura Sprouse, actually, is also helping us around our post-pension program. We're going to actually be providing our first post-pension, the Connect training in Menominee, New Hampshire this Friday, actually, for folks within our executive leadership, tribal affairs, our Office of Equity and Multicultural Services, communications, HR, different folks like that. And then we'll be working on some guidance agency wide, and other folks on the call, including Jonathan and Hunter. I see you. And so thank you for all your help too. And just real quickly, I promise, wanted to show you some of the pre and post survey results that Rachel had mentioned. So what you're looking at is about 7,602 responses to the pre and post survey. And you can see how, hopefully you can see how incredible the results are after, and just pointing out where folks are with their comfort and understanding around warning signs, for example, 19% pre, 72% post. How to ask somebody about suicide, 15% pre, 71% post. And then on the bottom, the understanding of suicide and suicide prevention, 16 pre and 70 post. And then this just real quickly demonstrates how valuable folks are finding this across the agency with the Oregonians they're working with, and also a giant ask for more comprehensive suicide training. So that is me. Thank you very much. I'm sorry I spoke really quickly, and now everybody is getting to see my computer. So thank you so much.
Well, Shannon and Rachel, just really remarkable work. You know, that little thing I did of hope, health, and healing and transformation underneath. I mean, you talk about a system that's really leaning into that idea of transformation, and works with so many people who are high risk, and also in jobs that can be high risk. So thank you so much for that work. And well, we don't have time today for doing questions, etc. We will definitely send out the information that has Rachel and Shannon's email and their PowerPoint that they shared with us, and really want to encourage coalitions to think about, there might be really creative ways for you to partner with your local ODHS to help you meet some of the goals that you're doing, or to share those. It's just really amazing to see what happens when leadership and staff really commit to making change. So with that, we'll switch gears a little bit here. And I'm seeing that Shannon's thanking Angela too. Yeah, I look around this room, there's so many intersections and connections and ways we all work together. It feels like we're a more connected field than we used to be. So now we're going to move into talking about the grants. And you may have noticed that we're starting not to call them mini grants. $20,000 is the upper limit of grants that were given out. And, you know, you could argue that those are maybe not mini. The first thing that we wanted to highlight was our map of the coalitions that we are aware of. And so all the ones that are in turquoise in here are counties that have a coalition. Now, if you happen to be on here and you're looking at this and you are from one of the counties that we don't have highlighted, and you say, but I know we have a coalition, please let us know. We'll add you to the list. The other thing I want to say is that one of the ways that this funding can be used is if you have a group that is prepared to start a new coalition and is bringing people together to do that. If you aren't on this, please do contact Jen Fraga. We have our email here. All right, next slide. So this will be familiar to some of you who've heard me speak about this before, but we have $417,338 to distribute across the state. And this is intended for regional suicide prevention coalitions, which are defined as being made up of multiple local organizations who are working together with a shared region-specific focus on suicide prevention. Membership will most often include people with lived experience and local leaders from multiple sectors. Most coalitions are county-based. A pause that I want to take here is I know there've been a couple of different groups that have asked whether they could apply for these funds if they're not a coalition. And I think, for example, I know, for example, if you are a for-profit or a consulting organization, what you would need to do to apply for these funds is to actually apply for them in partnership or as part of a project with a coalition. We really want to encourage creativity. This is funding that is coming from the Oregon Health Authority and as a result of a lot of advocacy by coalitions across the state and the Alliance. We have shifted the due date for the applications to June 6th. That's as late in our fiscal year as we can make that application and still review grants and let you know before the end of the fiscal year that you have been funded. Next slide. Wanted to share our timeline with you. Obviously, we're here today at March 13th. We will do another webinar on April 12th and give people a chance to ask questions then. We'll also be including frequently asked questions on our website. Did I see someone's hand go up? Okay. Due date. Sorry, yes?
I was just letting you know I didn't see a hand, sorry, but then I
Okay.
yeah.
Due date's June 6th, and our goal is to inform folks that they've been awarded this by June 22nd. The folks reviewing this will be people from the Oregon Alliance to Prevent Suicide, some staff from Oregon Health Authority, and probably will also partner with the University of Oregon Suicide Prevention Lab. The goal is very much to get the money out the door quickly to folks when they get it in, and these will be grants that are paid up front, and you then send us the information that shows us how you've spent the money after you've spent the money out. As we know that many coalitions don't have the kind of infrastructure to really provide kind of gap funding before they get funding from the actual grant. And the project timeline then will be July 2023 through June 2024. And you can spend the entire year in getting the project done, or you could aim it all towards September and say, we're going to have completed this by September. But there will continue to be some obligation beyond that initial project because we're asking for everybody who applies for this and gets funded to participate in a learning community that will include other grantees. Next slide. Our hope is to get this money out to as many different coalitions as we can. This is a shorthand way of saying we want you to be successful in making an application. And we've tried to make an application that should be fairly simple and straightforward to fill out. The applications will be prioritized as follows. The first priority will be establish suicide prevention coalitions that are regional or county-based. It's okay if it's a coalition that encompasses other prevention activities, as long as the funding is used for suicide prevention and for some existing ongoing structure to do suicide prevention. The second priority is groups interested in establishing a suicide prevention coalition. We're especially encouraging folks in counties that don't have one to think about that. And this grant can be used to establish one. The third priority will be establish coalitions that are focused on suicide prevention, but may not have a regional focus. So for example, there's a coalition of universities and colleges that are looking at suicide prevention. There's the Firearm Safety Coalition. That's subject specific to it. Those are the third priority kinds of organizations. And then the fourth priority will be if we have, if it turns out that we don't use all the funds. At this point with $400,000, there would be theoretically enough money for a coalition in every county to have funding. So we will see what comes into us. I'll just pause there and see if there's questions at this point. Okay, I'll keep moving us forward then. Wanted to just right up front share the scoring rubric that you'll be using. I know for me, when I'm writing for a proposal, it helps me to know about that. One of the things we've done with this rubric is we have each section we've indicated what it connects to. So for example, the project depression is section 2 questions. Project description is section 2 questions 1A through 1D. So as you're filling out the application, you can exactly walk back and forth and check to see if you've completed that section. That's the biggest chunk of the points. What's your idea? What are you thinking about doing? How are you thinking about doing it? We also are going to be looking for projects that center or serve the area of diversity, equity, and also center the voices and experiences of people with lived experience. We know that to be an effective coalition, partnerships are incredibly important. And so there's a look at who do you have engaged in your community, who's bought into being part of your coalition and doing this work. We ask for you to describe what the project roles will be. And it's really just who will do what. So you have a clear idea of how you're going to move the work forward. We ask a question about alignment with the suicide prevention framework, which we'll talk a little bit more about. And that's 10 points. The budget narrative, this can be a very simple budget that you submit. We just really need to know what it is that you want to spend the money on and how that money will support the project that you've described. And also just to be sure there is a place to receive the money, we really need to be sure there's a clear lead organization. And if there's not a lead organization, that you have found a way to find a fiscal sponsor. The priority 1, 2, 3, that's not something you have to score. We'll just, we'll know what that is by your application. And then finally, we ask that you have somebody from your coalition who agrees to attend most of the monthly learning communities we'll be having. Next slide, please. So I'm going to just walk you through what the application looks like, so you know what's coming up. It's the name of your coalition, and there's an opportunity to say we don't have a coalition yet. We are new. We're going to be forming one. The lead organization for the coalition and the type of organization that is. We know that there are some coalitions where local public health, the county public health is their lead organization. There's others where the county itself is the lead organization, others where there's a community mental health program, or maybe even a 501c3, but just to let us know what type of organization that is. Email and coalition contact, and then if you need it, who your fiscal sponsor is. And I want to point out that in the materials that we have on our website, about this grant, there is an attachment from the Oregon Nonprofit Association that describes fiscal sponsorship. And in that material are also two organizations that that one of their functions is that they will do fiscal sponsorships for people. So that's a resource for you if you're a smaller coalition that doesn't have fiscal sponsor at this point. And finally, in the contact information, we're going to just ask for a single point of contact for the proposal itself, so that we have one person, one email address that we're communicating back and forth with. Next slide. The very first part of the application, which is maybe in some ways the longest part of it, actually is not going to be scored, but it's going to be incredibly important, I think, to our work collectively to do suicide prevention in the state. This is really a landscape scan so that we can learn what's going on with coalitions around the state and have a starting point to understand sort of where are you now. It's also going to give us a way to look back after a year of doing this work together and assess what kinds of changes have there been. So I didn't write down every question, just sort of included a few sample questions in here. I actually think going through and answering these questions will be interesting for you all as you think through sort of where you are developmentally and what next steps should be for you as a coalition. Next slide. The second section is where you get into the scored parts of the application. And really the heart of it is these project proposal questions. We ask you to provide a summary of the project, and you'll see that we said project or projects. We've heard a couple of coalitions that are interested in doing more than one project and applying for the full 20,000. We wanted, one of the things about I'll tell you just about the setup of the application itself. It's on a Word document, and it has just simple tables under each question. It's a table with only one spot in it, and you can just write as much as you want in that. But we are very much hoping not to have applications that are 30 pages long. The application itself is 6 pages, including the rubric. And you can take however much space you want to, but we are encouraging you to keep it short, to the point. And we're not going to ding you for grammar. If what you want to do is bullet points, that's fine. Really just want you to get the idea across to us about what's happening. And so we are asking these really just basic questions. What is the projects? How will the funding be used? We'll ask about what process your coalition used to select the project. Like, so what was the rationale? Did you have a group of people get together to select it? What is the need or problem of focus that this project is addressing? And what are its primary goals? So that's the big, what is the project set of questions. Then we move down to, how does the proposed project address health inequities? How does the proposed project incorporate voices of lived experience and or young people? I should have said that earlier on. Both of those things we're valuing. Who are the partners or entities that will be involved in this project? So for example, if you're subcontracting some of the work out to somebody, or if there's specific local nonprofits that you're going to be working in partnership with on it. We ask, again, to broadly describe each role, who will do what. And then think about this last one. How does this project contribute to building or strengthening your work as a coalition? So along with doing some great suicide prevention work, one of our goals is really to be trying to build up our statewide infrastructure and supporting you coalitions to be able to be successful as you move forward. I will say the question has come to me about whether this will be funding that's available in the future. And I think that right now you should really look at it as one-time funding. There's not a guarantee of funding in the future. However, there is an ask for funding to move out to regional coalitions long-term. Right now, this grant is being used as a mechanism for it. The policy option package from Oregon Health Authority has asked that into the next biennium, and I think a lot remains to be seen about how that funding moves forward. The final element that you'll get scored on is looking at the framework pathways, the Oregon Suicide Prevention Framework. We include an attachment with the framework. There's also a 10-minute overview that you can click on to watch that Oregon Health Authority put together about the framework. And really, something I will say is that if you have a project or an idea that's connected to suicide prevention that your coalition's really excited about and you're having a hard time seeing yourself in the framework, that's certainly something that we'd be happy to talk about with you, think about with you. What we need to do during this process, though, is any question that we get, we will post the answer to it on our frequently asked questions. So that'll be available to everybody to try and keep a level playing field for all. Next slide. The other part of section 2 is really a yes/no answer. These are the dates for the Learning Collaborative meetings, and we're hoping that you can attend at least 8 of 11 of them. It's fine to have multiple people from your coalition attend. We think they'll be most useful to you if you do have at least one person or 2 people who are coming regularly. So we're kind of building community, building a knowledge base together. The other thing that's going to happen at those learning collaboratives is that's where the University of Oregon will really work with you around your evaluation process. They both will be able to provide you one-to-one consultation on that, and we'll do some work together in the shared space. And again, the goal of this evaluation is for it to be a very low barrier evaluation, but for us to be able to tell the story a little bit of the impact of this funding. And I think, as a lot of you know, this process of these grants was inspired in part by the very successful LGBTQ mini grant process. And those mini grants, which also went up to $20,000, actually resulted in hundreds of thousands of dollars of investments into those organizations that had those small grants, because they were successful at using those funds to leverage other investments into their work. And I think that's the kind of thing we can talk about at our learning communities, is some strategies to leverage this small investment in your community to help you for further work. Next slide. Section 3, again, is not scored, although we do ask you to fill it in. And it asks 2 simple questions. How will your organization know you are successful in achieving your stated goals? And are there any specific outcomes your coalition is interested in measuring? It looks like we may adjust one of our coalition dates. Hot breaking news as we hear that one of the learning communities is on the Oregon Suicide Prevention Conference Day. Next slide. Finally, section 4 is a projected budget, and we really came up with a very simple budget form. Here's a list of the types of expenses. You see, we haven't been very restrictive on what you can spend the money on. It can be on staff, consulting, subcontracts, materials, communications, overhead. 10% is the total that you can have for overhead. Stipends, for example, if you want to stipend youth or people with lived experience to do work with your alliance. Support for meetings, even travel to do a specific activity or to participate together in a conference, that kind of thing. We really want you to tell us what is the support that would help you and make a difference in terms of being able to sustain and move your work forward. And then the total amount that you could ask for is $20,000. Next slide. As we've described, you'll be getting support from the University of Oregon. Many of you know Jonathan Rochelle. Jonathan Rochelle is kind of the lead person on this work. He'll be working with us closely on this. We'll have our learning community and mutual support And then we'll also be really interested to hear from you if you think there's additional local support that you would like. So for example, would it be helpful to have someone come and facilitate a meeting on a specific topic? Or do you need some help thinking about strategic planning? Have you had some messaging, suicide prevention messaging issues you've been struggling with? I think there's an awful lot of that will be resolved inside of the learning community. Just there's nobody smarter than this group of peers. But also we really want to use this as an opportunity if there's some focused local support that's needed to bring that into your community. Next slide. So I bet almost all of you have seen this. This is the Oregon Suicide Prevention Framework. It's very high level. It is a familiar framework of intervention, prevention, and treatment. As you get down to more and more details, you will see that there's multiple pathways and multiple approaches that you can use in each of these areas. And next slide. The three framework pillars that are sort of the core elements of the framework are the first one, which is green. You'll see it in green, is healthy and empowered individuals, families, and communities. These are goals and pathways that seek to reduce suicide by promoting well-being and creating supportive communities for all Oregonians. Other terms you might recognize here are universal, primary prevention, and upstream prevention, or tier 1 strategies. The second pillar are clinical and community prevention services. You probably hear people refer to selected prevention, primary intervention, or tier 2 strategies. These goals and pathways seek to reduce suicide by focusing on strategic locations, groups, and sectors to promote well-being, to help navigate challenges, to decrease risk, and recognize warning signs early. And the third pillar are really the treatment and support services. And these goals and pathways seek to reduce suicide by focusing services and policies for those who experience suicidality or have been impacted by suicide loss. So the postvention belongs in this pillar 3. Other terms, not only postvention and treatment belong in pillar 3. Other terms you might recognize include indicated tier 3 strategies or intervention. Next slide. So what might this look like if you were trying to align an activity with the framework? These are just a few examples of projects that you could do. And these were just some that we came up with, and you certainly are welcome to come up with other ideas. But the first project example is to develop a strategic plan with clear goals for Suicide Prevention Month and sustainability. And that would align with that green section of the chart that you saw, which is the prevention section and coordinated activities. A second example, project example, is that you want to increase youth engagement through partnership with local sources of strength. That would fit in the green strategy as well, underneath the coping strategies. All Oregonians understand and have access to what helps them to cope with hardship as an individual and within their community, including culturally specific strategies. A third idea that would fall into the orange category, the second category, is increase coalition's ability to coordinate and manage local training, increase the number of people who receive assist training. And I'll just say to you, we paired in this example both increasing assist trainings along with increasing the coalition's ability to manage that, because we're hoping again that it won't be just one-shot single time events, but that some of this funding will use to help you be stronger in your ongoing work as a coalition. Next slide. Just a few more examples of activities that you might think about. So another example in the orange area of the framework is a safe storage distribution project in partnership with the local community mental health program. That's something you could really take on and do as a coalition, and that fits under the safe storage access. All Oregonians experiencing a behavioral health crisis have access to safe storage for medicine and firearms. And this is the final example. Again, these are just examples. These are not the only projects that you could ask for. It's just to give you a sense of how you work them back and forth between the framework. Stipend for suicide loss support group facilitators and trainings. And that would go under equipped and resource communities. Oregon communities are equipped to provide trauma-informed post-vention care for those impacted by a suicide death. So that was a travel through the application and the different pieces of it. Jen, I was wondering if you could maybe just quickly show people where it is on our website.
Yeah, let me just 1 second. Okay, so 3 more seconds. Let me just Okay, so when you travel to Oregon Alliance to Prevent Suicide, this is our home screen. The main headers up here have shifted a little bit, but you'll just Suicide Prevention Coalitions. And if you just hover over that, 2023 Coalition Grants is the only drop down underneath the Suicide Prevention Coalitions header. So you'll just click on that. This information right here, these first 3 bullets are really, they're directly from the application, just copy pasted from that, from the cover page, the first one. Down here, our application and attachments are here, and this was the Zoom link for today's meeting. I'll add information for the April webinar underneath as well. But this is where the application and attachments are, as well as a reminder due date.
Sorry, Jen, would you hit on the attachments? Let's show them what's in the attachments, because I didn't include that in much detail in the presentation.
Yeah, so there's more examples for folks for where things connect on the pillars. So a lot more examples there. There's also this is not a requirement for people to fill out. It was just provided by Jill Baker from OHA as a tool if you would like to use it when thinking about different activities and where they could sit on the framework. So it's a fillable PDF if you wanted to use that. It goes through every single pathway on there, all the different colors, different levels. There's also this guide that Annette found and shared out, this quick guide to fiscal sponsorship. If you need / want a fiscal sponsor, this really walks you through how you can go about doing that. And I think there's also a directory for where you can find a fiscal sponsor. But those are the attachments. So just tools and examples to help you through the application process.
So I am wondering if people have any questions.
And the FAQs, sorry, Annette, the FAQs will also be added to this page. I'll just, the page will just get a little bit longer because I'll just add each question and answer kind of towards the end, so that you don't have to worry about opening another link or another page, but those will be at the bottom of this specific page on the website.
Great. You know, we are so looking forward to hearing the different ideas you all come up with. What will be coming in.
Is it, Annette, I don't know if this is appropriate or not, but the LGBTQ mini grants, like some of those ideas, would it be just some of the, when you just said excited to see what comes through, the LGBTQ mini grants that the Alliance, AOCMHP, and OHA did 1 or 2 years ago, there was some amazing, fantastic ideas that came through there as well. So it's just really cool, like Annette just said, to see what works and what you all want to do in your communities and how suicide prevention work is just done across the state. It's really cool to see what y'all are doing. So I agree.
Jen, if you could show where there is on the website, if people want to look at that. Jacob, I think I saw you unmute.
No rush. All good.
So you just hover over about the Alliance, go down to Alliance committees and advisory groups, and then the LGBTQ plus advisories right here. So click on that link, it'll eventually load. It shouldn't be this slow for you. And then in addition to some other really cool resources, there's also this mini grant, our press release, quotes from some of the awardees, and then the different organizations and what their projects were are also listed on here. So for example, HIV Alliance in Lane County provided behavioral health and social support services to transgender, genderqueer, non-binary, gender non-conforming, confirming, questioning, and gender diverse people in Lane County. So there was a variety of just amazing, really, really cool stuff that was done. So I can put this link in the chat too. And Chris Bifulco, who is with AOCMHP, worked really closely on this with Annette to be able to get those out. So
Yeah, and we're looking forward to having a list like that someday on our website. We'll talk about all the coalition projects that you all have done. Jacob.
I was just gonna say, having the questions to write our program plan on what we're hoping to do, which is something we've been trying to do, is really helpful. So that helps answer a lot of questions and build our program. How would we write to maybe two opposite things? Like a youth-focused suicide prevention campaign, and then maybe like staffing or something like that. I mean, is it clear in the application, kind of like maybe it's two different bigger projects, and how would we write to that?
You know, I think what I would suggest doing is just like, if it's two separate projects, like naming them and just describing, so that you would have the answers for the questions, for example, like who's doing what. So say you were doing youth stipends, who's going to be in charge of that and making sure that happens and recruiting youth. And you were also paying a part-time position for a coordinator for 4 meetings or something. Then you would describe what the outcome of those meetings would be and what their role would be with that.
Thank you.
Yeah.
And Ned, is this the time when we would also let folks know, like, how with the, not grading is not the correct word, but with grading of the applications, kind of what the panel will look like for that and what that'll look like? Or is that not necessary to talk about today?
But it'll just, the panel will be folks who are not applying, but who are in the suicide prevention field. It will include, we will recruit a couple of people from the Alliance, and we will also recruit somebody from the Suicide Prevention Lab. But the ultimate decision, and we will be forwarding recommendations to Oregon Health Authority, and then OHA. These are OHA funds, so they make the ultimate decisions about where the funding goes and how much. Yeah, I actually got a question in my chat, but I think it's maybe relevant to more people. The question was, what happens if you have a coalition that has limited capacity? And so members are feeling worried about the capacity to actually apply for this and do this. I think I have a couple of thoughts about that. And I also think that we should pass this on as well to Jill and Shanda OHA, who were not able to be here today, but are going to listen to this recording and answer any questions. My thought is that one of the goals of this grant is to try and help strengthen and revitalize your local coalitions. And you know, that's a challenge if you're not being able to find any partners to do the work with you, because really coalition work is all about working in partnerships with multiple people. And it would make me wonder about whether you might be able to find a local nonprofit, another organization to do the work with, or to partner with you to get the work done. I think, you know, at the core, we want to be sure there are a group of people that are meeting together, that are cross-sector, that are able to think about the issues of suicide in your community. And so while I know as staff people, sometimes we have the bandwidth to do something, I would really encourage engagement from the other folks in your community as well, if you can. Any other questions? I know there were a couple of people who had asked things about needing to take this to their board of commissioners or board. And is there any other additional information that you need to take it to your commissioners if you have to have their approval? Well, I think we may have actually finished our webinar 5 minutes early. Michelle, did you want to say this out loud, what you just wrote? No, okay.
I wrote it, and that's why she's shaking her head. I didn't even ask her, I just wrote it. I'm sure I'm familiar with a lot of the amazing souls in this room, and so is Michelle. But as you know or may not know about us, that's kind of our underlying goal, is to increase capacity in communities. And we have lots of ideas of what that looks like. And I know Annette had mentioned earlier in regards to this, like someone like Michelle and I, as far as our private agency goes, would be looking to pair up with coalitions to potentially do trainings or capacity building in communities. So if you are a coalition that would like additional support with stuff like that, feel free to reach out to us, and we can chat with you and see how we can potentially partner to make some of that work happen where you're at.
Yeah. I really want folks to take an opportunity to think creatively about the equity opportunity too. Maybe there's a local group that is focusing on a population that's been underserved, under-resourced, that you might want to get engaged with your coalition that hasn't been engaged. And maybe there's something that you can be doing to support them that would actually build resilience and work towards suicide prevention. So I just think there's lots of opportunities for folks to think about how to move it forward. Really appreciate you all being here. As I said, we will be posting questions as they come in. Questions should get, if you have questions about the process itself, please email me. I think you mostly all have my email address, but I'll put it in here again. And other than that, I just wish everyone a really lovely week.